New leadership is appointed to the Clinical Transformation Department. Sinai-Grace rocks the Relay for Life, and the Marketing Department needs your feedback. These stories and more coming up next on Sinai-Grace Today. Hello, I'm Melanie Moss. Sinai-Grace would like to congratulate Dr. JoAnne Riggins, who has been appointed as our new Chief Medical Information Officer, and William Ford, who has been appointed our new Director of Clinical Transformation. In Dr. Riggins' new role, she will continue to have administrative responsibilities for the Clinical Transformation Department. In addition, she will focus on enhancing EMR for all clinicians. Our newly appointed Director of Clinical Transformation, William Ford, will be responsible for the day-to-day issues as it relates to any new electronic implementation projects. Sinai-Grace rocked the Relay for Life, raising nearly $3,000 for the American Cancer Society. The hospital had a great turnout of volunteers walking for this great cause. The Sinai-Grace team was even honored as the Rookie of the Year. Nice job, team. The Marketing Department would like to get your feedback on the Sinai-Grace Today television newscast and e-newsletter. This week, all employees will be receiving an email invitation to participate in a brief survey. If you don't have access to email, you can pick up and return your survey at the HR Service Center. Once you complete the survey, you will automatically be entered into a prize drawing. 5 employees will win a set of movie passes, and the department with the most employee participation will win a department pizza luncheon. With your help, our department can determine the best option for communicating to you. Diabetes is on the rise in Detroit, so Sinai-Grace is developing programs to support those with the disease. Tina Taylor has more.
A new team of diabetes experts has formed here at Sinai-Grace to help patients control their blood sugar while in the hospital. I'm here with one of those experts, Aimee Lamb. Aimee, can you tell us why the Glycemic Management Team was formed?
The idea behind the Glycemic Management Team was to better manage patients' glucoses while they were in the hospital. Blood sugars historically have not been managed very well.
And what are some of the goals for the team?
The goals for the team would include educating patients so they understand the process that's involved in taking better care of their diabetes, as well as training the providers and the in-house staff how to coordinate the care, because it involves everyone at every level. Diabetes is a very unique disease, and it's not just about medications and direct patient care.
Mm-hmm. So I know that with diabetes blood sugar management, we're really talking about medication as well as dietary needs. Tell me how you combine those two things with this new program.
Well, we're doing an initiative that we're piloting on several floors, and we're taking the blood sugar checks that patients do and coordinating it with their food and their medications, their insulin, while they're in the hospital, and teaching them the process so when they go home, they can better take care of themselves as well.
And what sort of results have you seen with the program so far?
We have seen a much increased percentage of management errors going down, taking better care of the patient by making them understand what they need to know, as well as providers now being able to understand how we can aggressively take care of patients while keeping them safe while they're in the hospital.
Thanks so much, Aimee. In addition to what's going on here at the hospital, we also have a diabetes education program to help care for diabetes when you're away from the hospital. I'm Tina Taylor for Sinai-Grace Today.
Hi, my name is Carolyn, and my question is carrots really good for your eyes, or is it just a myth?
This is a myth. Carrots do not improve your vision. Carrots do have a lot of good vitamins in them, like beta-carotene, as well as like spinach and broccoli, that will help your eyes to slow down certain diseases like macular degeneration and cataracts, but it does not improve your vision. So this myth is busted. Carrots will not improve your vision.
Hello, my friends. Conrad here. Are you regulatory ready? As we all know, the Joint Commission surveyors will be here soon, and it's time for Sinai-Grace's medical staff to shine. And we're counting on you to demonstrate to everyone the excellent care you and your colleagues provide day in and day out. With ongoing regulatory readiness in mind, really, I want each of you to pay a special attention to 3 key areas. First, documentation. There needs to be a date and time and signature on every medical record entry. Second, assessments. Pain, functional, and nutrition assessments need to be completed in the appropriate time frame. And third, what we're always concerned with, patient safety. Specifically, please, every time, ensure that you use at least 2 patient identifiers when providing care, whenever administering medications or collecting specimens for clinical testing, or providing any other treatment or procedure. When the Joint Commission surveyors arrive, I really expect all of the medical staff to adhere to these standards flawlessly. In the meantime, if you have any questions, please speak to your manager, call me directly at 313-610-5200, or talk to Nina Abubakari. We're all here to help. So please, be great, be prepared, be always regulatory ready. Thank you.
For these stories and more, you can visit our Facebook and YouTube pages for every episode of Sinai-Grace Today. I'm Melanie Moss. Thanks for watching.